complete blood count, or CBC, is one of the most frequently requested blood tests, and chances are you've had a CBC done at least once. So if it's that important, shouldn't you want to know what those numbers on your CBC result really mean? Follow the Lab Doctor GH as we uncover what your blood is really saying about your health. The complete blood count, also called full blood count, FBC, is like a dashboard for your blood. It gives a quick snapshot of your overall health and can reveal signs of infection, anemia, inflammation, and more, sometimes even before symptoms appear. It also guides your doctor on what to investigate next. Your CBC result measures 3 key components of your blood: red blood cells, white blood cells, and platelets. Each component provides important clues about your health. But how do doctors know if your CBC result is normal or not? That's where reference ranges come in. Your CBC result will include reference ranges. These are the normal values based on healthy individuals of similar age, sex, and sometimes even altitude. That means what's normal for one person might be slightly different for another, depending on their age, sex, or even where they live. And yes, reference ranges can vary slightly between labs. In today's video, we'll focus on understanding and interpreting the red blood cell component, the part responsible for carrying oxygen from your lungs to the rest of your body, and bringing carbon dioxide back to the lungs for removal. First up in the RBC component is the hemoglobin, or HGB. Hemoglobin is the protein within red blood cells that binds to oxygen. It's a critical measure of the blood's oxygen carrying capacity. Low hemoglobin levels are a hallmark of anemia, a condition where your blood can't carry enough oxygen, leading to symptoms like fatigue and shortness of breath. High levels can suggest dehydration or conditions affecting oxygen delivery, such as chronic lung disease. Next is the red blood cell, RBC count. This count measures the total number of red blood cells in a sample of blood. A low RBC count often indicates anemia, which can be caused by bleeding, nutritional deficiencies, or chronic diseases, etc. A high RBC count, known as polycythemia, may result from dehydration, lung disease, or certain kidney conditions. Then we have hematocrit, or HCT. Hematocrit represents the percentage of your total blood volume that is made up of red blood cells. A low hematocrit often points to anemia, while a high hematocrit suggests dehydration or polycythemia. Now, let's talk about mean corpuscular volume, or MCV. MCV measures the average size of your red blood cells. It's particularly helpful in classifying different types of anemia. When your MCV is low, your red blood cells are smaller than normal, what we call microcytic anemia. This often points to iron deficiency anemia or thalassemia. When your MCV is normal, but you still have anemia, it's called normocytic anemia, which can occur in chronic diseases or acute blood loss. And when your MCV is high, your red blood cells are larger than normal, known as macrocytic anemia, often caused by vitamin B12 or folate deficiency, both essential for red blood cell development. Next is mean corpuscular hemoglobin, or MCH. This measures the average amount of hemoglobin per red blood cell. It generally mirrors MCV. If red blood cells are large, they tend to have more hemoglobin, and vice versa. High MCH values are typically seen in macrocytic anemias, while low MCH values occur in microcytic or hypochromic anemias. Then we have mean corpuscular hemoglobin concentration, or MCHC. This measures the average concentration of hemoglobin inside red cells. It tells you how densely packed the hemoglobin is inside the cells. Low MCHC means the red blood cells have a lower concentration of hemoglobin and often appear paler. Low MCHC is commonly seen in iron deficiency anemia and thalassemia. High MCHC is less common. Finally, we have red cell distribution width, or RDW. RDW measures the variation in the size of your red blood cells. High RDW can be an early sign of anemia, while normal RDW indicates uniform cell size. When we look at RDW alongside MCV, MCH, and MCHC, collectively known as the red cell indices, we can tell what type of anemia might be present. They help classify different types of anemia and guide further testing. Remember, lab results are just part of the story. Always consult your healthcare provider to interpret your CBC in context. Follow the Lab Doctor GH as we break down the other components of the CBC results in upcoming videos.